Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. How can a health coach leverage free apps, the power of a smartphone, and their own training and behavior change to facilitate sustainable change in their clients, often reversing the effects of chronic diseases such as obesity? Well, our guest is Mr. Lee Jordan. He's an ACE, or American Council on Exercise, certified health coach. And he's joining us here on the program to talk about his work as a health coach, his own journey with weight loss, and also about helping other people through digital apps. Welcome to the program, Mr. Lee Jordan. How are you?
Hey, Neal. Great to be here. Thank you.
Now, as I said, you're an ACE certified health coach. How did you get into the healthcare industry as a health coach?
Well, I think as you sort of alluded to, it was quite by accident, I suppose. I was working in the technology field for several decades and found myself, long story short, at over 455 pounds, connected to oxygen, suffering, diabetes, hypertension, et cetera, and through a process of working with somebody and doing a small amount of exercise daily, was able to work through that, and then discovered my ability to take some of the tools and techniques I had learned previously and to augment that with certification and additional schooling and learning. But it started with American Council on Exercise's programs of training, and use that to help other people. So I left the technology business completely, and now for, 7 years or so, done nothing but help people throughout the United States that are trapped in their body and need to lose at least 100 pounds or more, reverse chronic disease.
Now, you weighed over 400 pounds, and you did a little bit of exercise, as you said, every day. How long did it take you to get down to a weight where you were comfortable, or at least more comfortable than you had been at your previous weight?
It took approximately, certainly big dramatic changes happened, relatively quickly in less than a year, and it was little, closer to like 2 years before it all kind of settled out. But in that process, I learned a lot. I worked with a behavior coach myself, and that made a huge difference. And kind of used my background in corporate training and development before I worked in the technology business, and kind of captured a process, if you will, which eventually became my physician-endorsed program, 30 Seconds to Victory, which is the framework that I use to help people throughout the country.
You took your expertise in an entirely different industry and applied that to helping others lose weight in the same way that you had. You say it was a process. What type of process are we talking about, and how is that process implemented into your practice as a health coach?
Well, specific to, I guess, the question that you kind of opened up with around using technology, apps, devices, wearables, smartphone, that kind of thing, I took that, and that's how I'm able to work with people that are not presently right in my, neighborhood, so to speak, or even my city or state. But a lot of people in the business that I'm in, and people that are end users, for lack of a better term, look at the apps and devices, and they think that, okay, what that really is about accountability, right? So they think that the accountability is the answer, but actually it's not. What technology does, that when it's applied appropriately, isn't really about accountability so much as it's about engagement or connection. So kind of think about it like in connection, not like, I guess, not like a dog on a leash, okay, but more like a kite, soaring in the sky, right? So you're still connected and grounded, but you're kind of moving based on what's important to you. And it really, when the technology is used appropriately, it facilitates a relationship and trust, and that is kind of the the difference maker right there, because what's needed for people to change and have sustainable change is really not tied to a sharp stick or a pot of gold or an accountability partner, even though people think it might be. It really has to do with their mindset and their values and their beliefs. That's where sustainable behavior change happens. What occurs is that there is, because of the framework under which this whole thing operates, how I work with people, it makes think about it like this: you have a coach in your pocket, right? If you leave the house without your smartphone, I guarantee you're going to turn your car around and go back and get it, right? You're not going to just go along with your day and think, oh, well, never mind. And they're ubiquitous now, so they're everywhere. And the computing power is unbelievable, so that there's a nice connection. And so it's really people developing a connection. That kind of connection isn't really about narrow and deep. So, for example, when you if you're trying to coach somebody or develop a relationship where you're spending an hour block of time or 2 hours of a week, that's sort of narrow and deep. But what really occurs is it's a touch, lots of little touches throughout the day and throughout the week. Those kind of, and being there as needed. That kind of approach seems to work quite well, because again, accountability and that kind of stuff is part of the equation. But Neal, I think about it like this. Behaviors are like dandelions. Okay, you can't really change them then, with surface solutions. You mow the grass, what happens? The dandelions come right back, right? You got to get to the root. You got to get to the foundation, and that's what this approach is. It uses that, and it can be done with anybody that has trained properly as a health coach, either through the American Council of Exercise or some other form, or has a background in, behavior change and that type of thing.
Well, Lee, where can we go and get some more information about 30 Seconds to Victory?
Well, you can, my website's leejordanhealth.com, or you can go to the American Council on Exercise, and they have, their website as well. You can just Google American Council on Exercise.org and pull it up easily. And they offer health coaching certifications as well as behavior change specialty certifications internationally. In fact, they're the largest credentialing .org organization, period. So that would be a step if somebody's out there that's looking at wanting to maybe do a little bit of this themselves or get involved in helping others. That would be one way to go. Or you can go to my website. I can point somebody in the right direction that way.
Right. Well, Lee, thank you for coming in and talking with us today about 30 Seconds to Victory and sharing a bit about your story and what you do as a health coach. It's been a pleasure.
Thank you, Neal. Have a great day.
You do the same. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in and download at SoundCloud. And be sure and follow us on Twitter, Facebook, and be sure and visit our affiliates page at hpr.fm.